I'm Sean Adams, a senior orthotist from the Bristol Centre for Enablement, and today we're going to be discussing various devices fitted in the wards. First off is an Aspen Vista collar. It is a multifunction collar with easily adjustable chin piece. Pull, rotate to adjust the chin piece. Same fitting as all normal collars. Needs to sit flush on the chest with the patient's head in a neutral position. Sliding the collar up, adjusting for the chin height, resting gently, attaching the posterior piece, making sure the patient is not in full extension or flexion. So universal size, easily adjustable with replacement pads available. Next is an Aspen Vista CTO. This is used in conjunction with a built-in Aspen Vista collar. It is for stability from C5 to T1. It is also a universal size device with the same easily adjustable chin piece and fitting procedure for a collar. It has various adjustments available to it that we would use to fit, but easy don and doffing with simple push and release clips for easy use both for nursing staff, physio and patients individually. This is a Titan CTLSO anterior piece. This specific device is used for stabilization of unstable fractures for various levels depending on the device being used. CTLSO would be from cervical level down to lumbar level, TLSO from T8 down to lumbar level, and an LSO, which would be the bottom component, from L1 to L5. Distinctive hip shape to show where fitting would be over the iliac crests. Adjustable chin piece would be done by the orthotists. Measurements needed would be sternal notch to pubis, waist, hip circumference, and then posterior measurement from C7 to L5. When fitting this device, it's important to note that when the patient is seated, the anterior distal trim lines are not digging into the tops of the thighs. This is the best way to fit the brace and to check whether or not it is fitting correctly. When fitting these devices, it's important to note that when the device is in situation, the distal end is not digging into the thigh, the chin is resting comfortably on the chin piece, the patient is not extended or flexed or retracted. This is a MKS modular spinal system. This version in particular is a TLSO, as seen by the extended posterior piece and a lumbar section with elasticized belt. Measurements for this device would be from sternal notch to pubis, waist and hip measurement circumferentially, and C7 to L1 posterior measurement. This brace is a multi-component which can be adapted to the patient's needs. The TLSO versions would be from T3 to L1, LSO versions from L1 to L5. When fitting all TLSO braces, it's important to note when the patient is sitting that the distal end or distal trim line of any TLSO brace is not pushing into the top of the thighs. Another thing to look out for would be that the top of the brace is not rubbing on C7. Next we have a Neurolux device which is used for shoulder stability following a stroke or any neurological condition. Measurements needed would be circumferential measurement across the chest and across the widest part of the forearm. When donning this device, it's very important to get the stitching where the stitching meets at the top of the shoulder to sit on the apex or the highest point of the shoulder. Next we have a basic wrist hand orthoses, easily modifiable to accommodate any position of a patient's hand by simply bending as you need. simplified strapping solutions, easily adjustable and easily manipulated to suit each patient. Measurements needed vary depending on device. Palm width, palm circumference, wrist circumference, and sometimes forearm length are needed. Next we have a Prafo boot. This is specifically used for protection of the heel, but can be used when patients have lost range and are starting to get plantar grade contractures, plantar flexion contractures. Adjustable arm to prevent rotation, and foot adjustability to accommodate plantar flexion contractures. But its primary use is for protection of the heel when in bed. Universal night splint to maintain range or prevent plantar flexion contractures would be warranted for people without compromised skin conditions. When donning the device, flex the patient's knee, set the heel deep into the boot, and attach the straps accordingly. Straps on the side can vary the amount of dorsiflexion or stretch applied to each individual patient.